Hello, I'm Lindsey Dunn, Editor-in-Chief of BECKER'S Hospital Review, and your host for the first edition of Healthcare This Week, featuring a roundup of the top 5 stories in healthcare brought to you by the editors of BECKER'S Hospital Review. Each videocast will include an overview of the 5 biggest stories in healthcare for the week and will be available on our website Friday afternoon. The videocast will also be included in our e-weekly newsletter each Monday morning, so you can catch up on the healthcare stories everybody's talking about. Now to this week's 5 biggest stories in healthcare. Our leading story comes as good news to employers. Per capita spending on employer-sponsored health insurance for people under 65 grew at historically slow rates from 2007 to 2011, averaging 4.9% annually, according to an analysis by the Healthcare Cost Institute. Still, spending on employer-sponsored insurance grew 1.6 percentage points faster than per capita national health expenditures and 3.9 percentage points faster than the GDP. And employee out-of-pocket spending went up by 8% per year. A new study by researchers at the University of Baltimore and Johns Hopkins found that the type of insurance a person holds impacts the quality of care they receive by healthcare providers. Not surprisingly, privately insured patients received the best care according to the study. Patients with private insurance had lower risk-adjusted mortality rates than patients covered by other payers, including Medicare and Medicaid, leading the researchers to suggest monitoring quality of care by insurance type could be a more useful way to reduce health disparities. Partners Healthcare in Boston and Hallmark Health System in Melrose, Massachusetts have signed a memorandum of understanding to create a new regional affiliation and expand Partners' presence in the coastal area between Boston and New Hampshire, referred to as the North Shore. The potential deal involves 4 hospitals, Lawrence Memorial Hospital of Medford and Melrose Wakefield Hospital in Melrose, both of which are part of Hallmark, as well as Union Hospital in Lynn and Salem Hospital, both of which are part of Partners' North Shore Medical Center system. The Federal Trade Commission and Securities and Exchange Commission are delving further into the pending transaction between for-profit hospital operators, community health systems, and health management associates. Earlier this week, CHS announced it received a request from the FTC for additional information related to its pending acquisition of health management, estimated to be worth $7.6 billion. CHS said the FTC's second request action was anticipated. CHS did not indicate what additional information was requested, but said it still expects the deal to close early next year. And for our last story to know this week, yesterday, House GOP leaders and President Obama met into the night to hammer out a plan to extend the federal government's borrowing authority and prevent a default. While the talks did not lead to an agreement about how to reopen the government, the GOP did agree to extend the debt ceiling for several weeks without a delay of the individual mandate. President Obama told the leaders he'd negotiate on the debt ceiling only after an agreement to reopen the government was achieved. As of right now, an agreement has not been reached, but many political insiders are calling the meeting encouraging. Now in its 11th day, Americans are eager for the impasse to end and for the government shutdown to return to normalcy. And those in healthcare are eager to find out whether or not healthcare reform laws will be affected. That's all for this week's edition of Healthcare This Week. We'll be back next week with 5 different stories impacting our industry.